Warm welcome, dear viewers, today to our health television. Optimization of our bodies. Everyone is indeed somewhat interested in always taking the best nutritional supplements, doing the optimal analyses, always, of course, with the greatest goal of being fit and capable. But does all of this also pose dangers? That is the big question here. Can we overdose on things and maybe not absorb some things at all? And maybe some things are just nonsense. And I will talk about this today with our doctor, Alexandra Kotthaus. Look forward to it. Hello, dear Alexandra. Happy to have you here.
Thank you.
Today we're bringing a little explosiveness into the discussion because we have an incredible number of topics, especially for health enthusiasts who really deal with everything, wanting to hear an expert on each topic and read specialist articles. And I have always been motivated in these matters. But at some point you realize, oh, somehow there is always something new. And then there's that person who only deals with one substance. Suddenly it's the ultimate solution for all diseases and everyone. And how have you been? I mean, you're also a doctor who really looks outside the box and is truly open. But have you also gone through processes?
Yes, of course. I started with the interest in health about 30, maybe even a bit more years ago, and I know that back then, tea tree oil, grapefruit seed extract, and so on also came up. And it was so great. They say it helps against the infection and this and that and the inflammation and against candida and at some point I then also realized, yes, this is not the philosopher's stone, until I maybe later was also resigned for a while, that I really said to meaningful books. Oh no, not this again. I already know all of this urgently.
So what does it actually come down to in the end? So what if we start from the analysis saying, okay, before we just blindly throw something in, I want to at least know what the current state of affairs is. Am I missing anything?
We're certainly not starting with the analysis. Yes, because we're starting, first of all, with the conversation.
Ah, yes, okay.
And if you can listen and also know how certain things manifest, like some deficiency states, in which symptoms, then you can actually get quite a bit out of that. And the other thing is, I look at my patients a lot. Sometimes they find it uncomfortable. And yes, I can also do face reading. And even there, organs and diseases are reflected in the face. A lot is already revealed or in the skin in general. And then there's also examination and palpation. And even there, you see a lot. There are so many people who already have such small spider veins over the liver.
Above the liver?
Above the liver.
So can you see it here?
Yes. And there are many bellies that already speak volumes just by looking at them, before you've even touched them. Also people who are actually very slim and the belly protrudes when lying down. Or actually, when it's lying down, it looks like cellulite. And then it's pretty clear I hardly even need a lab analysis to know, yes, the liver isn't breaking down the hormones very well. Once you grab the ankles, there are water retention issues. So there are already quite a few signs. And of course, there is a lot of background knowledge by now. It's just that our soils are low in zinc, in silicon, and depending on the region, there are deficiencies in selenium or iodine. These are just things that are known. And you can't really go wrong with certain dosages. And for some dosages, you shouldn't do that alone, or just blindly, certainly. And then there's also this thing, with which I'm seeing more and more often at the moment, that people on their own or also prescribed by doctors or alternative practitioners receive fat-soluble vitamins. And in part, you can really overdose on those and on water-soluble ones.
That's the classic, this ADEK.
Exactly.
But there is also a hype right now. Yes, then you need vitamin D, you need that vitamin A and K2. And that is still... Is it important?
I don't want to say that it's not important, but it might not be absolutely necessary to take it as a supplement. And I also cannot compensate for a poor diet with supplements alone.
Please excuse this very brief interruption, but we would like to kindly ask you to subscribe to this channel by clicking here. Thank you very much, and enjoy yourself further.
And I can already take in a lot about food, still in significant amounts nowadays, but not everything. And I can get vitamin K2 with a reasonable amount of greens. And I'm definitely a fan of very large amounts of greens, but you don't even have to consume this very large amount of greens a day to get to a reasonable K2 amount. And ideally, it should also be produced by the gut flora. And for a long time regarding K2, so certainly for over 10 years, there have been no studies specifically on K2 whatsoever. And the other K vitamins, K1, and as we already know for a long time now, promote the formation of blood clotting factors. That's why infants have been given it, so they don't get brain bleeding, or as an antidote to Macomar, which used to be, it is hardly given anymore, given when it was overdosed as a blood-thinning agent, that then very high doses of K1 drops were given until the blood clotting factors rose again. And I only found out, this is since last year, that there are studies on K2 and that they are doing that too. So I promote blood clotting with K2, which means I can also promote a thrombosis with it. And probably it happens so rarely because most people who are already thinking so much are also taking the 3K2 along with OPCs or vitamin C and perhaps are not eating entirely poorly. But ultimately that does it, and I can take it through my diet. So be it. If you take a mixture with D and K now and then think, yes, vitamin D is so important, I'll just give myself a high dose now, and then I'll also dose the K2 higher. And we don't measure it regularly, we've done it now, and also patients who come with analyses from outside with K2, I've seen that they are simply overdosed, but I don't prescribe it in the combination with K2 directly. So one has to also say that it was perhaps naive for a long time to recommend it that way.
Okay.
Vitamin E, one really has to also look at. You can also get it through diet. It's perhaps a bit more difficult. Also, there it is, fat soluble. I wouldn't overdose it and take a natural mixture. That's then the other thing, the quality of dietary supplements and the additives in dietary supplements. The availability. Yes, it doesn't end.
Yes, we recently talked about vitamin C. That one really says, okay, the basis of every inflammation is a vitamin C deficiency. That was sort of the topic now, and accordingly we need enough vitamin C. So there we have the classic pig, I was just about to say. Yes, the monocausal thinking. With that, we have solved all problems in our lives.
Exactly. I find the one cause and have found the philosopher's stone. Probably not. But vitamin C is, of course, a jack of all trades and is responsible for incredibly many processes in the body. It's for the gums, for collagen, for the bones, antioxidants, and certainly something that I give very regularly and find very important. But the form you intake it also plays a role. But perhaps, even if it is a thought jump, also regarding vitamin D, I see massive overdosing through self-medication, massively high. Now, I also had a non-measurable vitamin D level once and more hypercalcemia, so calcium shift. I have seen parathyroid hormone displacement. That also plays a role in bone metabolism. It's just crazy. And indeed, I didn't want to believe it many years ago either. Many people manage with around 2,000 units a day. And it doesn't have to always be 5 or 10. And with 10, we really start to get there slowly. Some even experience significant overdosing with 5,000 units a day. But with 10, it then also becomes slowly irresponsible to constantly do that on your own. And now taking 20,000 once a week isn't really sensible. Better a little bit every day.
Okay.
And it is actually a hormone and not a fat-soluble vitamin. That is, you don't just fish around in it, and it doesn't completely replace going outside in the sun. The sun also has effects that go far beyond that.
Well, what I have, of course, already observed, I have also given lectures on the topic for 20 years, but the resilience to the sun, so that you get nicely tanned but don't get a serious sunburn. I found that I've seen again and again that when the vitamin D level is in order, my body can handle sunlight much better. But that was just an observation.
Yes, it's also dependent on the antioxidant status, how the body interacts, and how quickly it burns, and whether it burns at all.
Yes, of course.
Now we were on vitamin C.
We were on vitamin C. A short jump back again. We were at the dosage form. Basically, there are those who now say it's all new. It's again the topic of liposomal vitamin C. What is liposomal? How does it differ? How much can I even store?
Actually, you don't store vitamin C. The liposomal is supposed to help it be better absorbed, more bioavailable, and get into the cell. I achieve the liposomal with lecithin, and that's also the source. Where does the lecithin come from? And usually there are two sources. One is soy and the other sunflower. Many companies also use soy lecithin. There are reputable companies, and there are companies that might pay less attention to quality.
Non-GMO soy, we get that, I think, somewhere.
That's difficult. With sunflowers, it's almost not at all. To my knowledge, there are none. At least the last time I researched, there are no genetically modified sunflower seeds.
None?
Exactly. That's why sunflower lecithin is absolutely the same.
Could I then combine it with ascorbic acid? Or do I really have to take a product where the vitamin...
No, that's already a specific preparation method. There are some tricks to make it at home with certain tools. I haven't done it yet. It's still far too cumbersome. But whether it really has the same quality and works the same way, I don't know. And whether it's really necessary for all vitamins. So we have a liposomal glutathione in our assortment. And there I find we really have an effect. I can feel it on myself as well. I've tried various companies with capsule form. I didn't have the feeling that I noticed anything from that. I should say that I usually notice something, so I make a pretty good test subject for that. I have the feeling that it has a potential effect, but one always has to be clear about that. B if n equal 1 is like equal to 0. So when my study group includes a person, it's not significant. However, we are now looking back on a very long experience with liposomal glutathione, and we would say, yes, it works. And the patients also have the urge to take it. What is the function of this in the body? Quite different. So first of all, glutathione is a substance that is mainly found in our red blood cells. And it is a potent redox substance. That means not just an antioxidant, but that the body can use it as it needs. And sometimes things need to be reduced, and sometimes they also need to be oxidized. It's not about swallowing so many antioxidants that we have everything reduced afterwards. Because then we are also not in homeostasis. However, we usually have so much stress and environmental pollution that we can certainly handle an extra portion of antioxidants. So that means with glutathione, the body can regulate it as it needs. It is also one of the most potent substances for this in our body. And it also detoxifies. It is a sulfur-containing substance that also helps us to detoxify quite gently and safely.
Could I then compare it a little bit to zeolite? Does it go in a similar direction, or does it have a completely different function?
No, not at all. It's more a kind of metabolic support. I would rather describe zeolite as a binding agent. And I wouldn't say that it's gentle and safe for everyone. So exceptions confirm the rule for all substances. But I have a somewhat mixed relationship with zeolite. It's not necessarily one of my favorites because I have seen some patients who react to it with constipation or even diarrhea. And I'm not quite sure if that's always a detox reaction or if it's really a bit harsh on the gut, making it say, I don't want this right now.
Yes, well, we also drink too little in that regard. That's another factor.
I've also tried that. I always ask when someone has constipation about their fluid intake. So that doesn't fit as an explanation.
Yes, okay. Regarding the glutathione, okay, would you consistently take something like that as a capsule for support, or is it only occasional?
It is always discussed, indeed quite permanently. No, I have, or we have simply products in our range that are sophisticated and partly based on plant extracts. So there are indeed several things in one, but they are usually not really multivitamins. So with a lot of things which might not even make sense or have a sensible dosage. And then I always say that is a baseline. With 3 products, I have supported the liver, supported the intestines, then supported the detoxification enzymes, so the detoxification pathways in the liver to a large extent. With few exceptions, which I then add individually, the nervous system, the blood formation, the immune system, hormonal regulation, and the baseline for that with 3 products, and the rest is a bit individual and also a substance. I do give glutathione sometimes over several months, but I change the detoxification substances. What I just described about supporting the liver and intestines, I call supporting detoxification enzymes. I always refer to as passive detoxification. And the active substances, I actually rotate through. Active substances / binders. As a binder, I also really like apple pectin. But glutathione, acetylcysteine, MSM, these are rather things that I cycle through. All of these substances have different binding spectra. And at some point, the potential of a substance is also exhausted. So glutathione may be the least, or ACC that makes sense, or NAC that makes sense again and again. But other substances I actually don't use for the long term. And sometimes it's also too much. At some point, you can also get fed up with it.
Yes, one might also want to listen to an inner compass again. There is also a need where one thinks, yes.
I also respect that. So I try to motivate A to uncover it again and listen to it. And many women have, most of the time it's women, already the right instinct and then let themselves be a bit misled from the outside. And actually it's quite important that you hear that. And at some point, when you start to forget a substance, it also sometimes has to do with the body saying it has had enough of it or doesn't want it anymore. Of course, there's also the little devil that sabotages you and says, no, let's not. There's still a gummy bear or the habit, which doesn't necessarily always have a deeper meaning and justification for the formation of the habit. But not every habit should be maintained. So that is this, like re-exposing the inner compass and then being able to differentiate. Is it now the inner lazy part, or is there really something in me that at the moment says no? And if a patient says, I don't want to take this anymore, I've had it up to here, then that's okay. I mean, I myself also take supplements for a ridiculously long time, and I once believed it could be done entirely without, just with great nutrition. But I increasingly have patients for whom, with great nutrition and supplements, it no longer works on its own. That is something I would clearly say to you. That is increasing. And then I also have phases where I say, no pills. Then I switch everything to liquid, and then at some point, no more taste, please. Then I take pills again.
But what are you taking? Or how do you figure out for yourself what you really need? So where is there really this need?
And one thing is, I know myself very well by now. I have become very sensitive to myself and my needs, and sometimes I also follow my feelings, or then I say, come on, do it again. Then I notice, when I reach for the packaging, that I don't really want it. And now and then I also have my blood taken.
And what in which? Because we also have big discussions about that. Yes, one says here whole blood, and the other doesn't count at all. One says, yes, in the blood itself, you can't see anything that happens in the cell later, ultimately in the tissue.
Most of it is nonsense, so I get an overview. With blood, I get an overview of many things, and measuring many things in the blood doesn't make sense, just because you can measure it. Yes, and I also find all the labs that offer really great measurements. And we biodoctors are indeed easy prey for that. But that doesn't mean that what I really lately seeing. If you want to measure, it is measured by the value as well. And then there's also the question of how accurately it is measured. Just because I have a value that is written in black and white, it doesn't mean that it has any significance. Just like me. So I learned in my undergraduate studies, that it's about the specificity and sensitivity of a laboratory value. And that means that the liver values and the kidney values only rise when 2/3 of the organs are damaged. And that doesn't seem to be common knowledge among doctors anymore. Instead, if the liver values are within the normal range, then everything is fine. There are also doctors who can diagnose liver steatosis with elevated liver values. Strange, I can't do that. I learned it differently. Do you need an ultrasound? And I actually saw both. A fatty liver without elevated values and no fatty liver with elevated values. So just like with Hashimoto, it is not just a pure laboratory diagnosis. Has anyone minimally increased their antibodies? That's not Hashimoto.
And if you think about it, sure, but L-Troxin is the most commonly prescribed medication. And you really have to look at who is doing this here.
And now here, the liver values, and they don't reflect the liver function for me. I can't determine how the liver is functioning from two values, GT, GPT, or depending on the country you're in, ASAD, ALAD. The liver has somehow 2,000 metabolic functions, and that's a tiny detail. And then I look at metabolic values. I mainly look at metabolic values also with B12, and doctors already know this without serum. B12 is not that informative. I might do hollow transcobalamin. I almost never see it reduced, even in severe deficiency states.
What would be some symptoms where you say, okay, there is definitely a B vitamin deficiency? If someone now says, okay, I really can't see it in the lab.
You can often see this when you can analyze the blood picture. So the blood picture is the hematogram and not what most people understand by blood picture. It doesn't mean, oh, let's do a comprehensive blood test. And then my liver and kidney values are included. Such a blood picture refers purely to the blood and not to the organs.
So do you read it based on hemoglobin and erythrocytes?
Exactly, the blood picture only refers to the cells of the blood. So red blood cells, white blood cells, and platelets. And there are differentiations in hemoglobin content, the hemoglobin content of the red blood cell, and an RDW value, which many doctors cannot interpret, that indicates anisocytosis. So for the variation of the size of red blood cells, here nutrient deficiencies already reflect in this, and in this combination of values with each other. And especially when now someone brings, this is always very interesting, when someone brings old lab values that are maybe 10 years old, and you can see that the MCV used to always be 83 and is now at 91, then something is wrong there. So MCV is the volume, the size of the red blood cells, and the most common is a B12 deficiency. Then it can be a folate deficiency. Then there are a few toxic reasons why that is the case, but by far the most common is a B12 deficiency. So of course not alone. That is a hint that the MCV is not conclusive, but it is first of all a hint, especially with the jump in size if you have prior values. And that is the other thing, to view lab values dynamically, because what I measure at time X is a snapshot. If someone now always has platelet counts of 150, 0,000, and then at the next blood draw has 350,000 and also feels somehow unwell, then that is an expression of an inflammation. But if you don't have the prior value and don't ask well, then depending on the lab, it will say everything is okay in the normal range. Or how often have I seen in the emergency room, leukocytes are at 8,000, everything is fine. But the person only has 3,500 or 4,000, otherwise always at such a regular level, feels totally sick and feverish, and then a jump within a few hours to 8,000 is indeed already a sign that something is not right.
Finally, just briefly, the topic can be refined for hours, just inflammations. The topic of omega-3 is also such a topic, omega-3 index, EPA, DHA, algae oil.
They do lab cosmetics, so they soothe their conscience by taking omega-3 fatty acids and still eating junk, and having the other fatty acids still bad high. So I would say that's like a smoker who eats healthily, but does not reach a level like a non-smoker who eats healthily.
Yes, that's now the question for the end consumer. Does it make sense to take omega-3 or not, independent from smoking or non-smoking?
There is no clear yes or no. So I sometimes measure without substitution a good fatty acid profile. Maybe not that often, but it happens because there are more and more people who eat consciously and also pay attention to which fats they consume. And you can achieve it through nutrition. The combination of food also plays a role, so that it can actually be converted into the right fatty acids. But it is also not completely impossible. And what do I get out of it if I have high omega-3 fatty acids, but also the unhealthy ones?
Yes, one might say, well, then the ratio is still okay.
Yes, one could say that. I'll leave it like that.
Dear Alexandra, now, finally, for the viewer who is saying, wow, now I'm totally confused, now I don't know what to do anymore, what tip would you just give once more, just on the topic of supplements, nutritional supplements?
It's a jungle at the moment, and it's almost impossible to navigate it alone. There are patients who put together very nice things at home, and with some, you can just see that they are hopelessly lost but want to do everything right, and they simply need help. And there are so many details, it's almost a study in itself. So I really just don't like to give generalizing tips.
Yes, that's why it's so nice when there are doctors who also take the time for patients. Because right now in Germany we have 7 minutes per patient for a public health patient. So nothing else happens there. You can really check that off. So if you want to approach self-optimization, you simply have to take care of it yourself. Without cards. So thank you very much for being here. I look forward to more interviews with you.
Thank you.
Thanks. Dear viewers, yes, we've just heard a jungle, but we always have wonderful guests here with us today who help us gain a bit of structure and also self-responsibility. And of course, I always look forward to your viewership. Thank you very much for that. See you soon. Bye.
Thank you for watching. From Swiss Health Television, QS24. Please don't forget to subscribe to the channel up here, as you can watch all shows ad-free. But also, subscribe to our YouTube channel, as that helps us a lot too. Here's a selection of shows put together for you that might certainly interest you as well. All the best, until another time, and goodbye to everyone.